we're happy to welcome John Erick Massamba. John Erick is a PhD student from the Congolese Foundation in Medical Research. John Erick, would you mind sharing your presentation? Okay, you can put it in presentation mode.
C'est bon, ça passe. Okay. F5. 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 Good. F5. F4. F5. Alors, c'est le diapo. Ici. Okay. C'est bon?
Here we go. Yes.
Perfect.
Perfect.
Thank you very much for giving me the follower. I am happy to present our work entitled Prevalence of Plasmodium falciparum, submicroscopic infection of and the pregnancy outcome in Congolese women at delivery. My presentation will be about this plan, background, material and method, result, and conclusion. As introduction, we can remind the over 30 million women become pregnant each in Africa and are in high risk of exposure to Plasmodium falciparum infection. In fact, malaria pregnancy remains a major health burden in South African, described the house of sulfadoxine pyrimethamine as the intermittent preventive treatment strategy during pregnancy. Inhibiting Plasmodium falciparum replication, therefore long-term has of treatment in malaria endemic setting may lead to continued rise of submicroscopic parasitemia. After IPT-ISP has been implemented in the Republic of Congo 2004. Few data exist on the prevalence of submicroscopic Plasmodium falciparum in Congolese pregnant women. And no of private study investigated the relationship between the submicroscopic infection and pregnancy outcome in the country. Thus, the present study is made to determine the prevalence of submicroscopic Plasmodium falciparum infection in women at delivery from Southern Brazzaville and investigate the relationship between the submicroscopic parasitemia and pregnancy outcome. It was a cross-sectional study carried out blood sample collected between 2014 and 2015 from women at delivery in a health center of Brazzaville. Of 370 women initially screened, 200 women had negative microscopic malaria test. and were then enrolled for the determination of Plasmodium falciparum submicroscopic infection by nested PCR method. According to a result, the prevalence of Plasmodium falciparum submicroscopic infection was 31.7%, 36.3%, and 12.9% when using the peripheral, placental, and cord blood, respectively. Compared to heightened mean and prevalence of Plasmodium falciparum submicroscopic infection in Africa. The prevalence of infection in general was higher in this study, where 58.7% of women were infected for a last on the blood compartment at delivery. 1.4% of women were infected in placenta and cord blood, but remained not infected in the peripheral blood. This finding underline the complexity and the dynamic of Plasmodium infection falciparum in pregnant women and allow to note that the no detection of Plasmodium by PCR in the peripheral blood does not reflect the absence of the infection in the placenta or in the baby cord blood. No impact of gravidity, mother of ESPUs was found of the prevalence of Plasmodium falciparum submicroscopic infection in peripheral, placenta, and blood of women. In addition, no significant association was found between the submicroscopic Plasmodium falciparum and pregnant delivery baby lobar weight, but the slight increased prevalence of anemia was observed in infected women. The study showed that the prevalence of submicroscopic Plasmodium falciparum infection is high in women at delivery in Brazzaville and might increase the risk for maternal anemia, the submicroscopic parasitemia, and low birth weight or preterm delivery. This result underline the importance to include in the malaria threatening program submicroscopic diagnostic methods. We acknowledge all these institutions. Thank you very much for kindly attention.
Great. Thank you very much, Jean Eric. Well, this is fantastic. Very, very interesting talk. We are almost running out of time, but I think we can have one question. What methods did the author use to determine or diagnose PF submicroscopic? Is there a follow-up sampling during pregnancy instead of sample collection at delivery only?
Please, the question?
What method was used to determine this submicroscopic PF? And is there any follow-up sampling after after delivery?
The sample collected at delivery only.